Okay, fine. Yes, hello, my dear friends here right now. Yes, yeah, thank you, Rajat. Now, my dear doctors, welcome here. This is like Dr. Azam here right now. We are going to begin with the anatomy discussion here right now, guys. Yes, anatomy discussion here right now. And now, in anatomy discussion, before beginning right now, guys, I just want to introduce one thing here right now. A very good news to all of you. A very good news to all of you guys. That on an academy we have actually clubbed with the prep ladder, and you are now going to get a dual advantage here right now, guys. You are going to get a dual advantage of iconic subscription. And in this iconic subscription, you'll be having both advantage of the prep ladder as well as an academy. And as you all know, yes, on an academy we'll be having like live classes, and then on the prep ladder you'll be getting the video lectures recorded as well as the question bank, guys. Apart from that, the very good news here right now, after for the next batch student, the students who are preparing for December exam, yes, so we are having our complete batch course, all the 19 subjects and all the renowned faculties, the best faculties are here. And out of them, anatomy will be completely taken care by me. Okay. now, now what we are going to do here right now, let me first of all tell you the entire thing here right now. Okay, what is our intention here right now? Now in today's class, my dear friends, I'm going to take the complete anatomy discussion here right now. Come on, guys. Now, no more, no more discussions here right now. No more, apart from anatomy, no other discussion here right now, guys. Now, for another 1.5 year, complete 1.5 hour, completely be along with me, and we are going to discuss about the upper limb topic, and we are going to discuss the most important one, that is your neuroanatomy topic today, and the head and neck topic today. And along with that, I'm also going to discuss many image-based questions where the students are having a fear. So many students have sent me a message regarding like discussion of image base. Yes, I'll do that today. And along with that, many students send me a message regarding the embryology part. So I'm going to discuss the embryology of the head and neck also, as well as neuroanatomy also, guys. Okay, so we are going to do all of that right now. So first, let's begin with the upper limb topic right now, guys. And now, my dear doctors, in this upper limb topic, what is the first thing that we are going to do right now? In the upper limb topic, the first thing that we are going to learn is the muscles of hand right now, guys. Many questions are going to come nowadays, guys. Nowadays they are asking like many times many questions, guys. So please remember here we are going to discuss about the the muscles of hand, and along with the muscles of hand I'm going to discuss all the injuries possible, guys. Nerve injuries possible, like partial claw hand, the complete claw hand, okay. And all those things, the Saturday night palsy and all those, guys. So, my dear doctors, without wasting any time, let's get started right now. Can anyone tell me, like in total, how many muscles do you have in the hand right now, guys? Yes, can anyone tell me in the muscles of hand, in total, how many muscles of hand do you have? Muscles of hand. I require a lot of interaction here right now. I require a lot of interaction here right now, guys, and I want you all to answer here right now. Just a few days left out for the exam. So please keep on answering. That will boost up your confidence. Yes, very good. There are totally 20 muscles in the hand. Lovely. There'll be totally 20 muscles in the hand. Out of those 20 muscles in the hand, this group of muscles that is below the thumb there, these are nothing but your thenar muscles. Okay. And then this group of muscles below the little finger here right now, this will be the hypothenar muscles, guys. So another 1.5 hour, you are completely along with me, guys. So keep on answering me here right now. So we'll be having like thenar muscles and hypothenar muscles. Lovely. Now how to learn them? Yes, there are 4 of them, guys. There are totally 4 thenar muscles and there will be 4 hypothenar muscle. How to learn their name? I'll tell you. Number 1, in the thenar muscle, you'll be having the flexor muscle, which is going to flex your thumb. And number 2, you'll be having the abductor muscle, which is going to abduct your thumb. And then number 3, you'll be having the opponents, guys, which is going to oppose. There'll be opponents pollicis. Fine. So flexion of the thumb here right now, and for abduction of the thumb, abductor. And then, my dear friends, you'll also have a muscle which is helping in counting here like this. Counting is nothing but like, opposing there, guys, opponents. Now what you do, the best way to learn, I'll tell you the trick here. Whatever first 3 muscles I wrote here, yes, do your favorite work, copy paste here. So number 1 muscle here will be your flexor. And number 2 muscle here will be your abductor, and finally the number 3 muscle here will be your opponents, guys. Flexor, abductor and the opponents, guys. Fine, perfect. Now I hope you all know that in the thenar muscle, thenar muscles are nothing but the muscles which are present below the thumb here right now. And these muscles, you can just add the word there as pollicis. Pollicis means thumb, and brevis there, guys. Flexor pollicis brevis. Yes, pollicis means thumb and brevis is like the short muscle. It's not longest. Yes, it is short. Now similarly, yes, abductor pollicis brevis, that is your abductor pollicis brevis. And remember, opponents you have got only and only pollicis. Opponents is just a single muscle there. Opponents is just a single muscle there, guys. So they don't have like longest and brevis there. So it is just opponents pollicis. Similarly, in the hypothenar muscle, you'll be having digiti minimi. Digiti minimi, guys. Abductor digiti minimi, flexor digiti minimi, and finally, my dear friends, you'll be having opponents digiti minimi. Fine. So that's, I think, the best way to learn about the muscles of the hand, guys, the thenar muscles and hypothenar muscle. Just be with me. I'll make sure that next 1.5 hour is going to be your utmost useful hour, guys, useful hour for your exam. Okay? And today our topics that we are going to discuss: upper limb, neuroanatomy, and then head and neck, along with the embryology, guys. So just be with me. I'll make it very, very beneficial for you people, guys. So just one and a half hour today, and then another 1.5 hour tomorrow, guys, and your entire anatomy will be done. So आराम से मेरे साथ में पढ़ते जाइए sir. Keep on learning along with me. So thenar and hypothenar, flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. Exactly on the other side, you'll be having flexor digiti minimi, abductor digiti minimi, and opponens digiti minimi. Then what about the fourth muscle, sir? Yes, in the thenar group of muscle, the fourth one here, add one more muscle, that is your adductor. That is your adductor pollicis, guys. Taken for adduction of thumb, and this is the most important one. I'll tell you the importance of that one. And on the other side, you can remember the fourth one, the different one, that is palmaris. And I told you already, it will be palmaris brevis, guys. It will be definitely what, guys? It will be brevis only. It can't be a long one, and it is a short one. So it is brevis there, guys. Done. So 4 thenar and the 4 hypothenar muscles are done, guys. Lovely. That is the best way to learn. Sir, but you told there are totally 20 muscles in hand. Okay. Now, after this 8 muscles here, there will be 4 muscles which are nothing but your lumbricals. There'll be 4 lumbricals, and then you have got the 4 interossei, that will be your palmar interossei. There'll be 4 palmar interossei, guys, and then there will be 4 dorsal interossei. There'll be 4 dorsal interossei. Don't worry, I'm going to even today I'm even going to discuss along with you all the images also, and I'll tell you how to identify if the images are given in the exam. So just be with me. So now I think you people are very good at mathematics, guys. Yes, you will are very good at mathematics. Hypothenar 4, the thenar 4, and after that the 4 lumbricals, 4 palmar interossei, and 4 dorsal interossei. Totally 20 muscles of hand are like done and done and done, guys. Lovely. Is it okay? That is the first thing that we are learning today. So all the 20 muscles of hand you can see on the screen there. Now once you are done with all these 20 muscles of the hand, okay. Want motivation? Yes, you want the action of the muscle? Don't worry, I'll teach you everything. Just be with me. Thoda patient. Okay now. Now my dear friends, yes, the muscles of hand, there are totally 20 muscles of hand. What is their nerve supply? What is the nerve supplying to all these 20 muscles of the hand, guys? Remember, all the 20 muscles of hand will be supplied by 2 nerves, that is your ulnar nerve, and there will be the median nerve, guys. So one will be your ulnar nerve and median nerve. Okay, ji? So there will be 2 nerves supplying, that is ulnar nerve and median nerve. So first I'll teach you about the nerve supply. Okay. And now my dear friends, at this moment, within few days you're having your exam. I think you all know very well that out of these 20 muscles of the hand, all of them will be supplied by ulnar and median nerve. And the ulnar is going to come from where? It is going to come from the medial side, sir. Here. The ulnar nerve is coming from here. Without any doubt, it will be supplying to the hypothenar muscle. So all the hypothenar muscles will be supplied by ulnar nerve. Okay, ji. है ना? Flexor digiti minimi, abductor digiti minimi, opponens digiti minimi, and palmaris brevis. All of them will be supplied by, yes, the ulnar nerve. And then, my dear friends, you're having how many lumbricals here right now? There'll be 4 lumbricals. And those 4 lumbricals, they'll be represented by numbers, and the numbering in the hand is always given from where? Lateral to medial, guys. Lateral to medial. 1, 2, 3, 4. 1, 2, 3, 4. So therefore, if the ulnar nerve is coming from here, definitely ulnar nerve is going to supply to 3rd and 4th lumbrical. Will it supply to 1st and 2nd? No, it will be supplying to the 3rd and 4th lumbrical. So the 3rd as well as the 4th lumbrical will be taken care by ulnar nerve. And after that, the ulnar nerve, the deep branch of that, will take a turn and go on the other side. Oh my God. It is going to supply to all the four interossei. That is your four palmar and four dorsal interossei. So ulnar nerve will supply to all the four palmar and dorsal interossei. And now welcome to the most important thing, the $1,000,000 point nowadays, guys. Ulnar nerve will go on the other side and it will be supplying to one of the muscle in the thenar eminence. And that will be your adductor pollicis. It's an exception there. Normally on this side we expect it to be the median nerve, but adductor pollicis will be supplied by, ulnar nerve. So whatever I have marked here right now, my dear friends, whatever I have marked here right now in blue color, all these muscles will be taken care by your ulnar nerve. I repeat again, all the muscles that I have marked here in the blue color are supplied by ulnar nerve. ठीक है ना? तो हम एक काम करते हैं, we'll do one thing here right now, guys. It's very important thing. Here, this is the place where most of the students will be getting confused. So we'll do one thing here right now. We will repeat this again right now. Come on. So you also, wherever you are, at your home, at your hostel, in your university, आप जहाँ कहीं पर भी हो, take your right hand like this and apply on your right hand side. Come on, start. Ulnar nerves come from here. And ulnar nerve is gonna supply to what, sir? All your hypothenar muscles here right now. It is gonna supply to all your hypothenar. Okay, welcome Akash. It will be supplying to all the hypothenar. Flexor digiti minimi, abductor digiti minimi, opponens digiti minimi, and the palmaris brevis. After supplying to that third and fourth lumbrical here right now. Very good. Third and fourth lumbrical. After that, it will be supplying to all the interossei, four palmar, four dorsal interossei, and then going on the other side, it will be supplying to adductor pollicis. If you count them, there'll be totally 15 muscles, guys. How many? 15 muscles. So out of 20 muscles, almost like 15 muscles are taken care by your ulnar nerve. Oh. That means, which is the dominant nerve in your hand? It is your ulnar nerve. It is controlling all the fine movements of your hand. That's the reason why all those fine movements are required for what, guys? They are required for playing musical instruments. And that is the reason why ulnar nerve is said to be the musician's nerve. क्या कहते हैं sir? Ulnar nerve is said to be the musician's nerve, guys. Lovely. So out of all the 20 muscles of the hand, 15 muscles are supplied by ulnar nerve. That is the dominant nerve in your hand. है ना बच्चों? So that is why it is known as musician nerve. Now it depends where you play the music. है ना? Lovely. And then apart from that, whatever is left out here right now, that will be taken care by your median nerve. So the median nerve will be supplying to the 3 thenar and then the first and second lumbrical. The remaining will be taken care by median nerve. So therefore, my dear doctors, yes, the median nerve is going to supply to what? Your thenar muscles, the flexor pollicis brevis, abductor pollicis brevis, the opponens pollicis, and the lumbrical number 1 and the lumbrical number 2. Is it okay? And whatever I have written here or I have highlighted here with yellow color there, guys, all of that will be taken care by your median nerve there, guys. So the reason why I'm telling you a little bit slowly here, aram se, guys, because if you understand this nerve supply, all these muscles and their nerve supply, then you can, solve many questions with this one. So everything highlighted there in the yellow color will be taken care by your median nerve, sir. Lovely, done. So all the 20 muscles of the hand, will be supplied by ulnar nerve and the median nerve, guys. Is it okay? Yes, it is also known as laborer's nerve. Very good. Okay. Next one. After completing their nerve supply, I think all of you are comfortable with this one here right now, guys. I think you are done with all the 20 muscles of hand. Names are done and their nerve supply is done, guys. So ulnar nerve coming from here and the median nerve coming from here right now, guys. Okay. So I want a thumbs up from everyone here right now if you are done with this one. If you have understood this one, guys, just confirm me. Yes, perfect. And now let me do one thing here. As I promised you people today, yes, very good. As I promised you people today that apart from, teaching you all these important topics here right now, yes, very good. Apart from teaching you all these topics here right now, I'll even make you perfect with the image based questions also. So let us welcome to the image right now, guys. Yes, let's welcome to the images right now, guys. Now whatever you're able to see on the screen there, thank you all, love you all, guys. Yes, whatever muscles that you're able to see on the screen here right now, guys, these muscles are nothing but your lumbricals. And how to identify if it is given in the exam? Yes, how to identify if it is given in the exam? You can identify that with the help of the origin. Lumbrical muscles, they will be originating from where you can clearly see these 4 tendons here right now. They'll be originating from the tendon. And my dear doctors, yes, can you please recall and tell me, it is like which tendon here right now? Lumbricals are originating from this tendon. Remember, it is the tendon of flexor digitorum profundus. That itself is your MCQ number 1. Lumbricals will originate from where? They are going to originate from the tendon of flexor digitorum profundus. Yes, and on the screen you are able to see there lumbrical number 1 and the lumbrical number 2 and the lumbrical number 3 and the lumbrical number 4. I told you numbering is always given from lateral towards the medial. Now my students are now expert. All my students here are expert in like L1 and L2. Come on, bolo bacho, loud and clearly, everyone. L1 and L2 will be supplied by which nerve only? These two will be taken care by your median nerve. Lovely. And after that, the third and fourth lumbrical, guys. Third lumbrical and the fourth lumbrical, these two will be taken care by your ulnar nerve. Okay, nerve supply, we already know about that. And apart from that, yes, apart from that, if you want to remember something more here, you can clearly see in the diagram there, median nerve is supplying to first and second lumbrical, and those two will be actually your unipinnate muscles. They are unipinnate muscles, guys. Lovely. They are originating only from the one tendon. And L3 and L4, the third and fourth lumbrical, those two are originating from the two adjacent tendons there. Yes, that's actually your bipinnate muscle, guys. That is another question possible here right now. Lovely. So my students are now expert with the nerve supply and then the unipinnate and the bipinnate. You can identify in the diagram itself. Okay. Next, after that, my dear friends, welcome to the action of the lumbricals here right now. What is the action of the lumbricals? The best way to remember the action of the lumbricals, yes, that is L shape. Okay, now lumbrical, remember that L for lumbrical, and make your hand like L shape like this. Is it okay? Yes, make your hand like L shape here right now. ऐसा ना L shape बना दो इसको ना ऐसे. So make your hand like L here right now, and you can clearly see what's happening here. So lumbricals are helping in flexion at metacarpophalangeal joint. Flexion at metacarpophalangeal joint and extension at interphalangeal joint. So keeping your fingers straight there. Flexion at metacarpophalangeal joint and then extension at the interphalangeal joint. आपने अपने टीवीज पर ना वो बहुत फेमस कॉमेडी शो देखा होगा, कपिल शर्मा शो, उसका सिग्नेचर साइन, वेरी गुड, ओके ना, दैट इज बाबाजी का टुल्लू. So that बाबाजी का टुल्लू is actually made by what, guys? The lumbricals there. So what is the action of the lumbricals? Right down there, it helps in flexion of metacarpophalangeal joint, and remember it's helping in the extension of interphalangeal joint, guys. Is it okay? So lumbricals are actually going to help you in, yes, flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. I think that's the best way to remember about the lumbricals, guys. So I think all your wishes are fulfilled here right now. I'm done with the action. I'm done with the image, how to identify in the image, and I'm done with the nerve supply. So nerve supply, action, and the image based discussion, everything done. And my students are now ready about lumbricals. Let them ask anything in the MCI exam, FMG exam, guys. We are ready now. Is it okay? We are ready. Done, done, done. After lumbricals, 4 lumbricals, I told you interossei. Interossei, guys. Okay, welcome to this interossei. Yes. Now, what is the meaning of interossei? Inter means in between, and osseous means what's the bone, in between the bones. And on the screen, you're able to see, yes, my dear friends, this is also like in between the bones here, muscles here right now, interossei. And these muscles are also like in between the bones here right now. That is your interossei muscles, guys. That is interossei. Take care. But sir, how to identify? Come on, guys. This is also like interossei here right now. And this will be also the interossei in between the bones only. Sir, if the diagram is given in the exam, then how to identify? Look here in the very first diagram, all of them are, yes, unipinnate muscles, and unipinnate will be your palmar interossei. Okay. So remember the first MCQ, they will be unipinnate. Okay, palmar interossei, guys. Okay, that is unipinnate. And remember, yes, the another one that is bipinnate, that will be your dorsal interossei. So dorsal interossei will be your bipinnate muscles, guys. So unipinnate muscles will be the palmar interossei and the bipinnate muscles will be the dorsal interossei. So जैसे आप diagram देखोगे, the moment you look at the diagram here right now, अगर आप यहाँ पर diagram देखोगे, my dear friends, yes, you can see they're originating from here. Yes, only the one bone here right now, guys. That is your unipinnate muscle. And the moment you see this diagram, they're originating from the adjacent bones there. That is bipinnate, guys. Yes, I have said it again there, guys. है ना? So this is unipinnate and this is bipinnate, present between the bones, palmar interossei and dorsal interossei. Come on, next thing, second, point number 2. Nerve supply. Remember, all your interossei will be supplied by ulnar nerve. All the interossei are supplied by ulnar nerve. Is it okay? Fine here right now. All the interossei are ulnar nerve, guys. Done. And after that, my dear friends, apart from the nerve supply, we have to remember action. Yes. Remember, palmar interossei will be helping in adduction of the fingers. So adduction of the fingers, yes, adding them, bringing them closer, guys. So you have to remember like this here right now, our middle finger will be the central axis and all the fingers coming closer. So bringing closer, which muscle is helping in bringing all the muscles closer there, sir? That is palmar interossei. Remember the very famous mnemonic, every medical student knows that palmar interossei will help in adduction of the fingers. Whereas dorsal interossei will help in taking the fingers away from here. And yes, my dear friends, dorsal interossei will be helping in abduction of the fingers. So it is helping in abduction, taking them away. So abduction of the fingers is done by dorsal interossei. Is it okay? So pad and dab, pad and dab. So palmar interossei will help in adduction of the fingers and dorsal interossei will help in abduction of the fingers. So action done, nerve supply done, and like image based also done, guys. So you are even able to identify in the image there. Is it okay? Yes, thank you, Kush. I think all of you are happy here right now. That completes the discussion regarding the muscles of hand, sir. Is it okay? So there are totally 20 muscles in the hand. Let us just revise once more here right now. It's such an important topic. It's very important topic, guys. So I don't want my student to leave anything in this one and go to the exam. So there are totally how many muscles in the hand, sir? There are totally 20 muscles in the hand. Point number one. Point number two, all of them are supplied by ulnar nerve and the median nerve, guys. Ulnar nerve and the median nerve. Okay. And out of that, 15 muscles will be supplied by ulnar nerve and the remaining 5 muscles will be taken care by the median nerve, guys. Is it okay? Fine here right now? Chaliye, badhiya sir. Lovely. And this is the way how you are going to identify lumbricals. They will be attached to the tendon. That is nothing but flexor digitorum profundus tendon here right now. Okay. And then the interossei, the palmar interossei and the dorsal interossei, guys. Done, done, done. Now, after completing all these 20 muscles of the hand and their nerve supply, and then I'm done with their, action also, everything is done. And now, my dear doctors, welcome to the injuries right now. Agar nerve injure hoga, to kya hoga? What is going to happen if the nerve is injured? Come on, guys. So as I told you, I promised you all people all image based discussions. Every images I'll show you here and I'll make you like perfect. Come on, start learning right now, guys. Look here. Now, my dear doctors, look here right now. Suppose if this is our hand here right now, all the muscles are supplied by your ulnar and median. Man lo ki ulnar nerve is injured here right now, sir. What is the nerve injured here right now? Ulnar nerve. If ulnar nerve is injured, all the 15 muscles here will be gone. And once these 15 muscles are gone here right now, guys, what is going to happen? Yes, what is going to happen, sir? My hand is going to become like this. Is it a claw hand? Yes. Is it complete or partial claw hand? Partial claw hand. Is it like complete or partial, guys? Partial claw hand. And that partial claw hand, what is the nerve involved? The nerve involved will be your ulnar nerve. That is what they're going to ask you in the exam. So what will they ask you in the exam, sir? Partial claw hand, what is the nerve involved? That will be your ulnar nerve, guys. Lovely. Is it okay? Now, I think you people can tell me more confidently. Yes, come on, guys. Answer me here right now. If ulnar nerve is involved, 15 muscles are gone here right now. Partial claw hand. What about if I want the complete claw hand? अगर मुझे complete claw hand चाहिए तो कौन सा वाला nerve injure होगा, sir? Which nerve is gonna be injured if I need a complete claw hand? Which nerve will be injured if I want complete claw hand? Yes, come on. Ulnar nerve, yes, all 15 gone. And if the median nerve is also injured, lovely. That's really nice. Look at that, Mohammed Pasha, Mukesh Sharma. Yes, very good. Yes, if the median nerve is also gone, all the remaining 5 muscles are gone and you'll be getting a complete claw hand. Yes. So complete claw hand, remember both your ulnar nerve as well as median nerve, guys. Lovely. Next one. Now, what about the wrist drop here right now, sir? See, look here right now. First of all, I hope you all know that in our upper limb, the posterior compartment of the forearm will be having extensor muscles. Anterior compartment of the forearm and the posterior compartment. Posterior compartment of the forearm will be having which muscles are extensor muscles here right now. Okay, now, and these extensor muscles, they are helping in extending the wrist like this, guys. They are helping in extending the wrist like this. So extending the wrist like this here right now. So therefore, my dear friends, remember, what is the nerve that will be supplying to all your extensor muscles? All the extensor muscles will be supplied by radial nerve. Ab maan lo, now just imagine that radial nerve is gone. If the radial nerve is gone, all your extensors are gone, and I am unable to extend the wrist here right now, sir. We are unable to extend the wrist here right now, and that is the reason why what is going to happen, sir? This wrist will be dropped, and wrist drop. What is the nerve involved? The nerve involved will be your radial nerve, sir. Lovely. Are you understanding, guys, here right now? So therefore, you need to remember the condition, like what is the problem, and then you have to remember the nerve involved in that particular problem, guys. Come on, let us revise here right now in that manner. Partial claw hand, ulnar nerve, complete claw hand, ulnar and median nerve, and then wrist drop, it will be the radial nerve involved there, guys. Lovely. And now, welcome to the next condition, that is Saturday night palsy. Now, first of all, try to understand that why did doctors give the name as Saturday night palsy? इसका नाम ना Saturday night palsy क्यों रखा गया है? You all know that in the weekends, you know, people will be drinking. In the olden days, people used to drink on the weekends, Saturday nights, है ना? People used to drink, and I think you people are very good. You all know very well about the drinking, है ना? मैं भी किससे पूछ रहा हूँ? Legends in that one, है ना? All my foreign medical graduates. So yes, guys. So on the weekends, the people used to drink, and after drinking, after full tully, they're not even like, you know, going back to their beds and sleeping there. They're lying on the chair. And on the chair, when they're lying there, what is going to happen? Yes, you can clearly see there, your humerus bone here right now. Behind the shaft of the humerus, what is there, sir? Yes. Behind the shaft of the humerus, you'll be having radial nerve passing in the groove there, guys. So that radial nerve will Saturday night palsy. Okay, so make some story there and remember like that, guys. Is it okay? So in Saturday night palsy, what is the nerve involved? So radial nerve, and the radial nerve will be involved in the radial groove, and you will never ever forget about that one, guys. Lovely. Now apart from that, I want to show you like some more conditions. Nowadays they're asking, guys. So let's learn here right now. That is your card test. Okay. Normally, I think, you know, when I'm taking the regular classes in the MCI for the FMGs, guys, FMG. So these things or these conditions we have not even discussed, I think. So now I want you to, you know, discuss along with me, because all of you are, you know, just few days before the exam, and so many of the students are interested, you know, here. So I want you to teach all these things here right now, sir. Now, what is a card test? What is happening here right now? Say, for example, I'm having a card and I'm giving to a person to hold between the fingers. And how the person will be able to hold, sir? By adduction of the fingers. Adduction. And adduction, I told you just now, pad and dab. Adduction is done by palmar interossei. So suppose if you're giving a card, the person is able to hold between the fingers here right now, guys. Yes, that is why it means that the palmar interossei are working very good and the ulnar nerve is perfect there, guys. Ab maan lo, ulnar nerve is injured there. If ulnar nerve is gone, palmar interossei are gone and they are unable to do adduction. The moment you give the card to a person, the card falls down there, guys. Yes. So card test is done for for assessing which muscle, palmar interossei, and that palmar interossei will be supplied by which nerve, guys? Ulnar nerve. Is it okay, guys? That is your ulnar nerve. Next one. Now book test here right now, sir. What about this book test? It is done for which muscle? Ab suno yahan par dhyan se. Now listen here very carefully. This is our thumb here right now, and this is the adduction of the thumb here right now. You all know adduction. And adduction of the thumb is done by which muscle? Adductor pollicis. And me, we are like normal person here right now, guys. You and me, we are like normal healthy individuals here right now, and you are giving a book to a person here like this, and he is holding like this. Adductor pollicis is working very well. Ab maan lo, now imagine that the ulnar nerve is gone. If the ulnar nerve is gone, adductor pollicis muscle is gone, and the person is unable to adduct. But still, books are our good friends. I don't want to give my book. What will I do? I'll still try to hold that, but this time it is not by adduction here right now. I'm going to hold that by, you know, flexing here right now. Acha, agar banda aise karega, if the person is going to flex like this, not holding like this, guys, but adductor pollicis, if it is doing like this here right now, then remember, gone. Ulnar nerve is gone, and it is for which one? Adductor pollicis muscle is gone there, guys. That is known as book test. Next one here. Pointing index. Yes, you all know what is the nerve here right now? The median nerve. Median nerve, these muscles are gone. Ask the person to, you know, make a fist. Okay. If median nerve is gone here right now, all these thenar muscles will be gone, and the first and second lumbrical will be gone. And is bande ko aap kya karoge? You ask him to make a fist. And the moment he is trying to make a fist, yes, these fingers will, you know, fold here like this. Why? Because ulnar nerve is working perfectly, but these fingers are not going to flex here right now. Why? Because median nerve is gone and these muscles here are gone there. So that is why when making a fist, if he is making the hand like this, which nerve is involved? The median nerve is involved. Similarly, you can even remember the hand of benediction hand. And benediction hand also, which nerve is involved, guys? Median nerve. I think you have been to church. I have been to the church a lot of time in my life. In the church, you know, the priest over there, the Pope, yes, benediction. Okay, benediction there. So hand of benediction like this here right now. Which nerve is involved, guys? That is your median nerve is involved. And finally, the ape thumb. Ape thumb deformity is one of the hot favorite question in your MCA exam, guys. Ape thumb deformity is one of the hot favorite question in your MCA exam. So my dear doctors, remember here right now, see what you do right now is that you just keep your hand relaxed here right now. In human beings like you and me here right now, all our fingers will be in one plane, whereas the thumb will be a little bit abducted here right now, guys. In human beings, yes, in human beings, what is going to happen? All the fingers will be in one plane and the thumb will be abducted. Ab मान लो, now remember that the median nerve is injured there, guys. If the median nerve is injured there, all these muscles will be gone except which one? मैंने कहा था आपको याद रखो. I told you to remember. Except which muscle? If median nerve is gone here right now, all these muscles, thenar muscles will be gone except which muscle? Adductor pollicis. Why? Why? Because it will be supplied by which one? The ulnar nerve, guys. Understanding here right now? Adductor pollicis. Why? Because it will be supplied by ulnar nerve. समझ में आ रही बात आपको? So therefore, adductor pollicis is still working, and because of that, what will happen? Your thumb will come and lie in adducted position like this here right now. Thumb will be in adducted position, and it is coming along with the fingers over there, and that is why in this condition, what is the nerve involved? Median nerve, and this type of hand is a feature of apes, and that is why it is known as the ape thumb, guys. Lovely. Okay, so all these deformities you have to remember, and believe me, my dear friend, MCA exam is one of the easiest exam. They'll ask you like all direct questions, guys. Direct questions they're going to ask you in the exam. Yes, and then the nerve involved there, guys. So welcome here right now. Yes. चलिए एक बार ना हम लोग फिर से रिवाइज करते हैं. So let us revise very quickly right now. Very quickly, let us revise here right now, guys. Partial claw hand. What is the nerve involved? Ulnar nerve. Complete claw hand. Ulnar and median nerve is involved. And then the wrist drop, radial nerve. And your favorite one, Saturday night palsy. Again, radial nerve is involved there. And the card test is done for ulnar nerve, and the book test is again done for which nerve only, sir? Ulnar nerve. Which muscle? To check which muscle? Adductor pollicis. And then, my dear friends, pointing index, the nerve involved will be your median nerve, and hand of benediction hand, again which nerve is involved? Ulnar nerve, sorry, median nerve there. And then ape thumb deformity, yes, which nerve is involved there, sir? Median nerve is involved there. Understanding, my dear friends, here? So to understand all these conditions without mugging up, if you want to understand all this condition, what is the requirement here right now? Muscles of hand. पहले आपको muscles of hand पता होना चाहिए, then you can learn all this, conditions, guys. So we have completed like so many points here right now. I think all of you are comfortable here right now, guys. Is this revision beneficial to all of you guys? Come on. Yes, lovely. Welcome to this table here right now. Now, partial claw hand, ulnar nerve, complete claw hand, ulnar plus median nerve, wrist drop, radial nerve, Saturday night palsy, again radial nerve. Yes, carpal tunnel syndrome, ape thumb deformity, and the pointing index. It is median nerve involved. And then cubital tunnel syndrome and Guyon's canal, card test, ulnar nerve is involved. And then regimental sign. What is regimental sign, guys? Loss of sensation. Loss of sensation over this area, upper lateral side of the arm. Upper lateral side of the arm. And the nerve involved, there will be axillary nerve. And I'll tell you about these three conditions. Welcome to the next one. That is your brachial plexus here right now. I think, guys, this is like very high time here right now. Everyone knows about the brachial plexus. Brachial plexus will have like roots, trunks, division, cords and branches. ये तो सबको पता होगा. Now welcome to the trunks here right now, guys. So we are not going to waste the time on the topics which are easy for you people, and you have learned that one. Welcome here right now. So the trunk. There are totally three trunks in the brachial plexus. That is your upper trunk, and then the middle trunk, and then you have got the lower trunk. If there is an injury to the upper trunk, it will lead to a paralysis. What is the name of that one, sir? That is your Erb's paralysis. है ना? And what is the sign of Erb's paralysis, guys? That is policeman's tip hand. Policeman's tip hand. Similarly, if there is an injury to the lower trunk here right now, lower trunk injury, it will be known as Klumpke's paralysis. Klumpke's paralysis. And what is the sign of Klumpke's paralysis, sir? That will be your claw hand. Claw hand will be the sign of Klumpke's paralysis. I hope you are able to recall this one. And apart from that, I think you are able to see here C5, C6 and C7. There is a nerve coming here. This nerve will be your long thoracic nerve. Injury to the long thoracic nerve that will lead to a condition. That condition is known as winging of scapula. Winging of scapula. So these conditions, these three conditions, most of the students, yes, I know that 110% almost every student will be learning once or the other time in their life. So I'm just doing it very quickly, guys. Is it okay? So injury to upper trunk, Erb's paralysis, policeman tip hand. Injury to the lower trunk, Klumpke's paralysis. Klumpke's paralysis will be claw hand. And the injury to the long thoracic nerve that will lead to winging of scapula, guys. Done. So these are all the conditions to be remembered in the upper limb part. Now let us move towards the next thing. Sensory supply. Sensory supply, another thing important. Last December exam question, they have asked about the palmar surface. And you can clearly see on the palmar surface, this highlighted region here right now, guys, medial 1.5 digit here right now. The skin covering the medial 1.5 digit is supplied by ulnar nerve. And the skin covering the lateral 3.5 digits here, 3.5 digit here will be supplied by your median nerve. And last December exam question was, there is a patient having loss of sensation on the medial 1.5 digit. Loss of sensation on the medial 1.5 digit. Then what is going to happen? Which nerve is involved? What is the question in the last December exam, December 2019? Understanding? So remember, it will be your ulnar nerve, guys. Wow. And on the dorsal surface, welcome to the dorsal surface here right now, guys. Dorsal surface, again the same thing here right now, the medial 1.5 digit. The medial 1.5 digit here right now, yes, will be supplied again by what, guys? Ulnar nerve. And you have to be like really careful with the lateral 3.5 digit. Why? Because only this distal phalanges, I repeat here again, lateral 3.5 digit, only the distal phalanges, which are highlighted there in the green color, are supplied by median nerve. That's important. On the dorsum of the hand, they'll be supplied by median nerve. And my dear doctors, the remaining which is not highlighted here, that will be taken care by the radial nerve, sir. So radial nerve will be supplied to the remaining dorsum of the hand here right now. I hope you are able to recall this. Okay. And in our regular classes on the Unacademy platform, in my regular classes, I'll be, the students who have attended along with me, my regular classes of anatomy, I'll be making them draw this diagram properly and, learning in detail. Now it's all about rapid revision, recall very quickly, guys. Okay. Now, so let's do it again, sir. Palmar surface, 1.5 digit here right now, ulnar, 3.5 digit here right now, median. On the dorsal surface, 1.5 digit here right now, ulnar, and the remaining 3.5 digit here right now, distal phalanges, median, and the remaining by radial nerve, guys. Lovely. Next one. Another very important concept for your MCI exam, FMG, nerves related to humerus. There are totally 3 nerves which are related to humerus, guys. Now, which 3 nerves are related to humerus? Number 1, axillary nerve. Axillary nerve will be related to what, sir? It is passing behind the surgical neck of the humerus. Okay, next one. Second one will be your radial nerve here right now. Radial nerve is going to pass in the radial groove. Yes, it is also known as the spiral groove, guys. In some of the textbook, it is written as spiral groove also. And yes, you can see there the medial epicondyle. Behind the medial epicondyle here right now, that will be your ulnar nerve. So how many nerves are related to the humerus, guys? There will be 3 nerves related to humerus. Axillary, radial, and the ulnar. Is it okay? Already ulnar nerve has been asked in your MCA exam 2018. Radial nerve next immediate exam in 2019 it has been asked. So be ready. It's a very important concept, guys. Done. Lovely. After completing this concept here right now, I think you are able to revise now, sir. Hello everyone. I think you people are able to revise right now rapidly. Next one, guys. Another very, very important question here right now, guys. This one, image base. Last year 2019, this image was given and this muscle was marked here right now. And they have asked just a simple question. What is the name of the muscle? Marked there. What is the name of this muscle which is marked here right now, guys? Welcome. How to identify? I'll tell you this one. First of all, you can clearly see here, this is the back view. Back view here. Now in this back view here, my dear friends, you can clearly see this is above the spine here right now. Above the spine of the scapula. That is why it is supraspinatus. What is the name of this muscle, guys? Supraspinatus muscle. This muscle will be like below the spine and that will be infraspinatus. Beautiful, lovely. Doctors have given the beautiful name, guys. Above the spine, supraspinatus, and below the spine, it will be infraspinatus. Okay, पहले इसको ना ऐसे याद कर लो. And once you remember these two like this here right now, after that, my dear doctors, welcome. This is the lateral border and the medial border of the scapula. And I can clearly see that there is one muscle here, and I can see clearly here, this is like one muscle here, and this is another muscle here. Okay, I don't know about you people, but I remember here like this, guys. This lateral side will be having the teres muscle. And above there will be minor, and below there will be teres major. Ho gaya. And on the medial side also you'll be having minor and major, and that will be your rhomboid. A rhomboid minor and the rhomboid major, guys. Rhomboid or rhomboideus minor and the rhomboideus major. Lovely. Okay. So the best way to remember, above the spine supraspinatus, below the spine infraspinatus, guys. Okay, na? Spine ke upar or spine ke niche. And after that, on the lateral side minor and major, and on the medial side there will be minor and major. Okay, but please remember very, very carefully, the muscle which is present below is major. इफ स्टिल यू आर नॉट एबल टू रिमेंबर, अगर अभी भी आपको नहीं याद हो रहा है कि नीचे कौन सा वाला होगा, कम ऑन, डू योर 2 fingers like this here right now, sir. I think in the regular classes, every anatomy faculty will teach you like this only. Do your 2 fingers like this here right now. Upar wala minor. Okay, now you can see here, this is a finger which is like little bit smaller finger, guys. And niche wala will be major. Yes, you can remember with your favorite finger there. Yes, I think I don't have to tell, that is a bigger one. Okay, so upar wala minor, niche wala major, guys. Lovely. So on the lateral side, there'll be teres minor and major. And on the medial side, there'll be rhomboid minor and the rhomboid major, guys. And what was the question in the December exam? Image based question. And in that image based question, they have given just this muscle, guys. What is the name of the muscle? Teres major. You get 1 mark. Is it okay? Lovely. Chalo, guys. After that, now the next one. Can anyone answer me this question here right now? Forgotten muscle of the rotator cuff. Forgotten muscle of the rotator cuff, guys. Can anyone answer me here right now? Someone is answering correctly there. Yes, Yeshwant, Amulya, very nice, very nice. It is your subscapularis. So I am now moving towards which topic? Rotator cuff. Look at this diagram here right now. Rotator cuff is actually made up of 4 muscles there, guys. It is made up of, 4 muscles. Every student will remember that as, SITS. Every student remember that as SITS from the first year MBBS onwards. But my dear friends, Hanji, my dear friends, I am going to do a little bit modification here right now. इसको भूल जाओ, हम इसको ना थोड़ा सा modify करते हैं ऐसे. So S and then I and then T and then dash here then S, guys. Okay, na? Sir, why are you doing like this? Look here. This muscle which is present above the spine here right now, that is your supraspinatus. Lovely. And this muscle present below the spine here right now, this is infraspinatus. Okay, lovely. I'm done with supra, I'm done with infraspinatus. And this muscle here right now will be your teres minor. And sir, why are you writing this as small t here right now? Why? Because most of the students in the exam, they're getting confused. Okay, na? Ke minor tha, ke major tha, minor tha, ke major tha, teres minor or teres major. Better write down their t as a small letter, guys. Welcome to my anatomy classes. Okay, na? Better write down that t as a small letter. And you will never ever make a mistake in the exam. That T stands for teres minor. And sir, why did you write down all these muscles separately here right now? Why? Because you can clearly see all the 3 of them will be inserting on greater tubercle. All the 3 of them will be inserting on the greater tubercle. So supraspinatus, infraspinatus and teres minor on greater tubercle. And one more muscle which is going to form the rotator cuff here, that will be your subscapularis, in front of the scapula. And I wrote it separately here right now, that S stands for subscapularis. And you can clearly see here, that is getting inserted onto this lesser tubercle here. Okay, ji? So this is greater tubercle here, and this will be lesser tubercle here. It's inserting onto the lesser tubercle. I think this mnemonic will help you in remembering forever in your life, guys. Thoda sa modification, SITS. And yes, one more importance, guys. One more thing that you can remember from here is that I wrote this muscle separately there, and that itself is nothing but the forgotten muscle of the rotator cuff, sir. That is a forgotten muscle of rotator cuff. So let them ask anything in this topic, we are ready right now. Insertion of the muscle, the forgotten muscle, the 4 muscles of the rotator cuff, everything is done, done and done, guys. Lovely. Next concept in the upper limb topic here right now, sir. Yes. Can you please answer me this question here right now? All of the following structures passes deep to flexor retinaculum. All of the following muscles, yes, all of the following are going to pass deep to flexor retinaculum, except which one, guys? Except which one? Thank you, Hamid Mansoor. Thank you, Deepak. Thank you all. Okay. Yes, all of the following are for passing deep to flexor retinaculum, except which one? Okay, welcome here right now, my dear friends. Okay, now here in this hand here right now, my dear friends, you are able to see here the carpal bones, and then there will be a retinaculum. So therefore, you can clearly see in this diagram here right now, this will be your carpal bones. They are actually arranged in the form of an arch, carpal arch here right now, guys. This is known as carpal arch. And this here right now will be the flexor retinaculum. This is flexor retinaculum. And then, my dear doctors, you are able to see below the flexor retinaculum, there will be formation of a tunnel. And this tunnel is known as your carpal tunnel. इसी को हम ना carpal tunnel कहते हैं. ठीक है जी? So that is your carpal tunnel that is present below the flexor retinaculum. Now you need to learn, suppose if this is flexor retinaculum here right now, there are certain structures going above the flexor retinaculum, superficial to that, and there are certain structures going deep to flexor retinaculum. And remember, if anything is going deep, that is nothing but, yes, going through the tunnel only. It's going through the tunnel only, guys. So superficial and deep, है ना? Superficial and deep, guys. And I can clearly see the three structures here right now. This is your nerve here right now, ulnar nerve. And there's an artery there, guys, ulnar artery. And there's only and only one tendon. That is your palmaris longus tendon, guys. So what are the structures passing superficial to flexor retinaculum, ulnar nerve, ulnar artery, and the palmaris longus tendon? The structures passing superficial to flexor retinaculum, ulnar nerve, ulnar artery, and the palmaris longus tendon. All of them are going to pass superficial. Remaining anything is given in the exam, yes, everything is going to pass deep to flexor retinaculum. And deep to means what? They are going from the carpal tunnel only. Lovely. Now, my dear friends, we started the topic from there only. What are the two nerves which are going here right now? What are the two nerves which are going here? Ulnar nerve and the median nerve. If this ulnar nerve is going superficial here right now, then where is median nerve? Median nerve is going deep to the flexor retinaculum. Median nerve is going deep to flexor retinaculum. And my dear doctors, that is like $1 million question in your MCA exam. हमेशा वही सवाल, बार वही सवाल. What is the nerve involved in carpal tunnel syndrome? Carpal tunnel syndrome, the nerve involved will be your, yes, that is your median nerve. Carpal tunnel syndrome, the nerve involved will be your median nerve, guys. Lovely. Acha. Not only that, my dear friends, one more thing. The students are confused with what you know. They are confused with cubital tunnel syndrome. Cubital tunnel syndrome, remember that nerve involved will be your ulnar nerve. And recently asked in the MCA exam, Guyon's canal syndrome. And in the Guyon's canal syndrome, the nerve involved will be again which nerve only? Ulnar nerve only, sir. Guyon's canal syndrome, again which nerve is involved, sir? Ulnar nerve is involved there, guys. Is it okay? Now, after completing this concept, welcome to the last and final concept and very important concept to be revised in your upper limb topic. Already even last year also, 2019 also, there was a question given about the anatomical snuff box. You know anatomical snuff box? I think you people are I'll tell you one natural method of doing snuffing today, guys. I think this is like online and it is not good also, but still yaar. Chalo, karte hain. I'll tell you the best way to do snuffing. Extend your thumb here like this, sir. And after extending your thumb here like this, ऐसे extend करने के बाद ना, yes, look here right now. There's a beautiful space formed here right now. ठीक है ना, यहाँ पर ना space form होता है, depression formed here right now. And what you do here right now? Yes, put whatever you want to put. आपको पता है कि what I'm telling, sir. Okay ना, B. So all that our favorite substances like cocaine and all, आराम से यहाँ पर डालने का, and then yes, what you are going to do, sir? Style में snuffing करने का. You are going to do स्टाइल में स्नफिंग किया राइट नाउ सर, है ना, ऐसे. तो इसीलिए डॉक्टर्स ने इसका नाम क्या रखा है सर? एनाटॉमिकल स्नफ बॉक्स. आई हैव सीन इन ऑल दोस मूवीज एंड ऑल, दे विल बी मेकिंग दोस कोकेन लाइंस ऑल, फिर उसको ना करेंसी नोट से लेके ऐसे स्नफिंग करते हैं ऑल दैट नॉट रिक्वायर्ड हियर राइट नाउ. टेक दिस एंड डू स्निफिंग देयर. लवली. एंड नाउ वेलकम बैक टू एनाटॉमी हियर राइट नाउ. यस, तो डोंट टेक मी रॉन्गली गाइज, ओके ना, सर बड़े एक्सपीरियंस लग रहे हैं, तो don't take me wrongly here right now. It's all just for the sake of understanding here right now. I think ऐसे अगर याद रखोगे बड़ा आसान हो जाएगा. If I start teaching you like a serious anatomy professor there, boundaries and the contents of anatomical snuff box, you'll go mad. Okay ना, पता नहीं कहाँ से धुआं निकलेगा. Yes. So extend the thumb here like this, and then you'll be able to find here right now there is an anatomical snuff box. Okay. And now, my dear doctors, yes, what is the boundary? Laterally you'll be having like two tendons there, guys. And what are the two tendons on the lateral side? That is nothing but your extensor pollicis brevis, and another one will be your abductor pollicis longus. Be very careful, it is abductor, AB, abduction, abductor pollicis longus. And medially there'll be only and only one tendon, and that one will be your extensor pollicis longus there. Extensor pollicis longus. Boundary is important. And after that, what is the content? You can clearly see there is only and only one content there, sir. Artery, that is your radial artery. Radial artery is the only content of the anatomical snuff box. That's the best way to remember there, guys. Okay. Thank you all. Thank you all, guys. Okay. Done and done. Okay, lovely. And that completes our discussion about the upper limb topic, guys. So as I promised you, we have covered like almost everything very important in the upper limb topic, and the remaining things, I think they're like very easy stuff and you can easily manage with that one, sir. So everything Everything difficult has been covered here right now. Other things, the easy things, you can easily manage them, guys. Now after that, now welcome to the head and neck discussion here right now, sir. In the head and neck, yes, welcome here. Yes, guys, welcome here right now. Can anyone answer this question? Can anyone answer this question here right now, guys? Yes, middle meningeal artery is passing through which foramen? Foramen ovale, foramen spinosum, foramen rotundum, and the jugular foramen here right now. Yes. Now welcome to head and neck topic. In the head and neck topic, the very first thing that we are going to learn about the cranial foramens and the structures passing. Yes, yes, very good, very good. Look here right now. These are your cranial foramens here right now, and through the cranial foramens, like what are the structures passing? Let us revise them very quickly here right now, my dear friends. Okay, now that's a very important concept, and I'm expecting one question from this concept in the next exam, guys. Okay, so welcome to the cranial foramens. Yes. Here you're able to see one big one here right now. So there's a plate, that is your cribriform plate. And in cribriform plate, what is the structure passing? That is your cranial nerve number 1. Olfactory nerve will be passing. Just behind the cribriform plate, you're able to find your optic canal. Try to identify in the image also. They can even ask you the image based question also, guys. So there's an optic canal. And what is passing through optic canal? Optic nerve, cranial nerve number 2, along with the artery, that is ophthalmic artery, guys. After that, yes, these three are very much important for your MCA exam. You'll be able to find the three foramens. You can remember that as ROS. Foramen rotundum, foramen ovale, and the foramen spinosum. Foramen rotundum, foramen ovale, and the foramen spinosum here right now. Foramen rotundum, ovale, and spinosum. Foramen rotundum, there will be cranial nerve number 5-2. And what is the meaning of cranial nerve number 5-2 passing from here? So there is nothing but your maxillary nerve. And remember foramen ovale, that is cranial nerve number 5-3. And what is 5-3? 5-3 is nothing but your mandibular nerve. And my dear doctors, foramen ovale, it's the hot favorite of the examiner. Remember, not only mandibular nerve, other structures also going to pass. And all the medical students remember that with the mnemonic as male. Remember, male passes through ovale. Male passes through ovale. Mandibular nerve. What is the number, sir? 5-3. Trigeminal nerve, that is the third branch of the trigeminal nerve, sir. Okay, now mandibular nerve. A stands for accessory meningeal artery. A stands for accessory meningeal artery, guys. And L for what, guys? Lesser petrosal nerve. Lesser petrosal nerve. And finally, E stands for your emissary veins, guys. Lovely. So what are the structures going to pass through the foramen ovale? Remember, male, and male passes through ovale, guys. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and the emissary vein. After that, you are able to find the foramen spinosum here. And foramen spinosum is the one through which passes the middle meningeal artery. And then along with that, a nerve, nervus spinosus. Name of the nerve is easy, foramen spinosum and nervus spinosus. But remember, the artery is very much important, sir, middle meningeal artery. And I hope you have learned the other subjects very well also in radiology. Yes, you have to learn that, you have to identify that one, guys. If there is a rupture of this middle meningeal artery, it will lead to hemorrhage, that is known as epidural hemorrhage. And you people are very good at radiology. You have to take a scan and identify how to differentiate the epidural hemorrhage and subdural hemorrhage, guys. Okay. Foramen lacerum, it is the one through which internal carotid artery is going to pass. You can see the margins of that, they are very much lacerated. Foramen lacerum, internal carotid artery. After that, internal acoustic meatus, 7th and 8th cranial nerve. After that, jugular foramen, then the 9th and then 10th and 11th cranial nerve. And my dear friends, there will be a small opening here right now, hypoglossal canal, that is your 12th cranial nerve. All the cranial nerves are actually going in order. All the cranial nerves are going in order there, guys. So internal acoustic meatus, 7th and 8th one, jugular foramen, 9th and 11th, and the hypoglossal canal, 12th one. And then out of all this foramen, there is the biggest foramen here right now, foramen magnum. And remember, it's medulla oblongata. Many students I have seen during my live classes, guys, I have seen that they are doing a mistake. They are telling what is going to pass through the foramen magnum. They are telling spinal cord. Remember, it's absolutely wrong. It's written very clearly in the Gray's Anatomy 41st edition. Foramen magnum, it will be still medulla oblongata passing. medulla, and after that the spinal cord is going to begin from your C1, guys. So keep a clarity here right now. It's given very clearly in the Bible of Anatomy, Gray's Anatomy, 41st edition, latest one. So what is going to pass through foramen magnum, sir? Medulla oblongata, along with the cranial nerve number 11, and then the vertebral arteries which are going to go up and supply to the circle of Willis and the brain there is. Lovely. So all the cranial foramens, and if there are foramen, if there is an opening, something should be passing and the structure is passing, guys. Done, guys. Lovely. Is it okay here right now? Somebody in the middle, they're writing that, they're not able to understand or something like that. Guys, please remember in your minds that this is all like, revision classes, specially made for the students who are going to appear for the exam. So we're not doing like, all our regular classes. Welcome to my regular classes. Most of the students who have attended my regular classes, they know very well okay, how in detail we'll be going and all. Now this is like for just quick revision so that you can have in your, memory, and you can able to, recall very quickly in the exam. So this is like, rapid revision classes. So somebody in the middle, they're just writing like, can't understand and all. I think you just welcome to our regular class. You'll understand in detail, guys. In detail, I'll teach you. Don't worry. Now it's only for rapidly revising for the exam going students. Welcome. Can anyone answer me this question here right now? Can anyone answer me this question here right now, guys? Accessory muscle of mastication. This question was asked in the exam. Yes, it is nothing but your buccinator muscle. Accessory muscle of mastication is buccinator. So now let us discuss about the topic of muscles of mastication. In total, how many muscles of mastication do you have? You have got like 4 muscles of mastication. Is it okay? In the diagram number 1, you're able to see this muscle. Can you please tell me which is this one? That's your masseter. And what is the name of this muscle here right now, guys? This one will be temporalis. And in the last diagram, you're able to see the pterygoid muscle here right now. And that will be your, yes, there'll be 2 pterygoids, lateral and medial. And how to identify in the image here right now, this muscle which is going and meeting with the temporomandibular joint here right now, that is your lateral pterygoid muscle. This is the lateral one, guys, lateral pterygoid muscle. And this one which will be present on the inner side of the mandible here, this is your medial pterygoid muscle, guys. So I repeat again, how many muscles of mastication do you have, guys? You have got like 4 muscles of mastication. So here this is masseter here right now, this will be temporalis, and then on the inner side you'll be able to find the lateral and medial pterygoid. Okay, now what are the important points to remember here? Point number 1, that is your question number 1, guys. Okay, what is the nerve supply to the muscles of mastication? That will be again your 5-3 mandibular nerve. Question number 1. Question number 2, which muscle is the only muscle helping in depression of mandible, opening the jaw? The only one muscle which is helping in opening the jaw, depression of mandible, is lateral pterygoid muscle. Lateral pterygoid muscle is the only muscle helping in depression of mandible, guys, opening the jaw. And another thing that you have to remember here right now is accessory muscle of mastication. And I told you already which is the accessory muscle of mastication, sir. That is your buccinator. So buccinator muscle present in the cheek there. It is the accessory muscle of mastication. And nowadays they're asking one more important question here right now. All these muscles of mastication, which is most commonly involved in trismus. The most commonly involved in trismus will be your medial pterygoid muscle. A lot of controversy surrounding this one. Many students recently, guys, a lot of messages from the students. Okay, sir, which is most commonly involved in trismus? That is locked jaw. Yes, the answer is given like differently in different books. But remember, the final answer here right now is medial pterygoid muscle. So what are the 4 points to remember? Nerve supply, mandibular, opening the jaw, lateral pterygoid, accessory muscle of mastication, buccinator, and the most commonly involved in trismus will be medial pterygoid muscle, guys. Lovely. Now answer this one, guys. Fill in the blanks quickly, guys. Another very high yield question for your MC exams. All the muscles of the facial expression are supplied by facial nerves. That is your 7th cranial nerve. Every medical student knows that. Muscles of facial expression by 7th nerve, except which muscle? That will be the levator palpebrae superioris. Already asked in the MC exam. Take care about that one, guys. Levator palpebrae superioris muscle, and that will be supplied by your 3rd cranial nerve, that is your oculomotor nerve. It's a direct question, guys, remember. So all the muscles of the face will be supplied by facial nerve, except for which one? The levator palpebrae superioris, and that will be taken care by your 3rd nerve. Okay, that is oculomotor nerve. Now welcome to sensory supply to the face. The sensory supply to the face will be by trigeminal nerve. Come on guys, you might be thinking sir is teaching very seriously here. Okay ना, थोड़ा सा enjoyment भी करते हैं बीच बीच में. Yes. Are you able to sense the pain from your face? Yes. Will you be able to sense the touch from your face? Of course. हम लोग ना touch तो बिल्कुल feel कर सकते हैं सर face से, और हमारी सारी कहानी शुरू वहीं से तो होती है ना, है ना. So you are able to sense the touch from your face also. Pain from the face, the pressure from the face, everything from your face will be carried by your trigeminal nerve. Which nerve guys? Trigeminal nerve. है ना बच्चों? And now I can see most of you students are like smiling there. हाँ हाँ हाँ, उसने मुझे यहाँ touch किया था. किस nerve ने feel किया था? Trigeminal nerve. But don't be happy. If you don't study, your daddy will also touch. और जब daddy touch करते हैं ना, that will be with all the sensations. Okay ना? Touch. प्रेशर तो भरपूर होता है उसमें, टेम्परेचर तो वैसे बढ़ जाता है, और पेन का तो पूछो ही मत, है ना. सो योर एंटायर फेस इट विल बी कैरिड बाय विच वन गाइस? दैट विल बी कैरिड बाय योर ट्राइजेमिनल नर्व, एक्सेप्ट फॉर वेयर? एक्सेप्ट फॉर द स्किन ओवर एंगल ऑफ मैंडिबल. स्किन ओवर द एंगल ऑफ मैंडिबल. Okay, skin over the angle of the mandible there guys, and that will be supplied by what? Remember, that will be supplied by the great auricular nerve. That will be by great auricular nerve guys. Lovely. Okay, so these two exceptions you have to remember when it comes to the nerve supply of the face guys. So the muscles and the sensory supply, the motor supply and the sensory supply guys. Okay, next one sir, look at this diagram here right now. Yes, in this diagram the skin covering the angle of the mandible here right now will be taken care by your great auricular nerve. That's the image from your Gray's Anatomy textbook guys. Lovely. Next one, which one is the safety muscle of tongue sir? Oh, another very important topic, that is your tongue topic. Tongue topic is very much important here right now guys. Remember these extrinsic muscles of the tongue sir, there are 4 external, or we can say extrinsic muscles of tongue. How many are there sir? 4 of them. कैसे याद करोगे? हाउ यू आर गोइंग टू रिमेंबर? रिमेंबर आगे पीछे ऊपर नीचे, आगे पीछे ऊपर नीचे. आगे वाला मसल यू कैन क्लियरली सी जीनियोग्लॉसस, पीछे वाला दैट इज कमिंग फ्रॉम द स्टाइलॉइड प्रोसेस, स्टाइलोग्लॉसस. ऊपर वाला मसल सर दैट इज पैलेटोग्लॉसस, और ये जो नीचे वाला जो मसल है ना, दैट विल बी योर हायोग्लॉसस गाइस. क्या बात है. सो आई डोंट नो अबाउट यू पीपल, आई रिमेंबर इट लाइक दैट. आगे पीछे ऊपर नीचे. कम ऑन. एनका मुंदु पाइना किंदा. क्या बात है. So genioglossus, styloglossus, palatoglossus and the hyoglossus, there are 4 extrinsic muscles guys, and out of them you have to remember the most important thing, that is the safety muscle of the tongue. Which is the safety muscle of the tongue? Genioglossus. Genioglossus will be referred to as the safety muscle of the tongue. Which is the largest muscle of the tongue? Remember, genioglossus, that is the largest muscle of the tongue. And remember the third question here right now, which is not a true muscle of the tongue, and that will be your palatoglossus. It's not the true muscle of the tongue guys. It's given in the name itself. It's the muscle of the palate as well as the muscle of the tongue also. So it is not at all a true muscle of the tongue guys. So genioglossus, safety muscle of tongue, and the largest muscle is again genioglossus. And remember the palatoglossus. Palatoglossus is not a true muscle of the tongue sir. So these are the points to remember in the tongue topic. And apart from that, I hope all of you remember the nerve supply of tongue. You have to remember about the nerve supply of tongue also. And in our classes, I've given you a beautiful method there. There's your 5, 7, 9, 9, 10, 10 sensory supply, the special sensation as well as general sensation. मैंने आपको बताया था, ठीक है? चलिए sir. After that, welcome to muscle innovation here right now, sir. Yes, the muscle innovation here right now. I'll do one thing here right now. I'll just write down here in the easiest manner possible, and you also start writing in the in the form of one line here right now. One line is like one question. Come on, tell me guys. All muscles of tongue, all the muscles of tongue will be supplied by which nerve guys? Can anyone answer me here right now? All the muscles of the tongue will be supplied by which nerve? All the muscles of the tongue will be supplied by which nerve guys? That is your hypoglossal nerve. That is your 12th nerve. By 12th nerve. Thank you Neha. Thank you Neha Narang. All the muscles of tongue are supplied by the 12th nerve, except for which muscle? Except for palatoglossus muscle, and that will be taken care by the vago accessory complex guys. Remember the vagus and accessory. The 10th and 11th nerve, vagus axillary complex. Number 2, all muscles of larynx will be supplied by what? All the muscles of larynx will be supplied by a recurrent laryngeal nerve, except for the only and only one muscle, and that will be your cricothyroid muscle. And cricothyroid muscle is the only muscle present outside the larynx. Outside the larynx, yes, external laryngeal nerve. That's the best way to remember. Number 3, guys, all muscles of pharynx, all the muscles of pharynx will also be supplied by vagoaccessory complex, except for two muscles of the pharynx here right now, sir. One will be your cricopharyngeus muscle. One is the cricopharyngeus muscle, and another one will be the stylopharyngeus muscle, guys. And out of that, my dear friends, cricopharyngeus muscle will be again taken care by recurrent laryngeal nerve only, but stylo is supplied by the glotho. ओके ना, स्टाइल मारने के लिए ग्लॉस लगाना ना जरूरी होता है, तो स्टाइलोफैरिंजियस विल बी सप्लाइड बाय ग्लॉसोफैरिंजियल नर्व, है ना. नंबर 4, गाइस, all muscles of, yes, mastication, all the muscles of mastication will be supplied by which nerve? That is your mandibular nerve. 5-3. And remember the one more thing here right now, all the muscles of, yes, palate, all the muscles of palate are supplied by again what, sir? Vagoaccessory complex, except for which muscle? Tensor veli palatini muscle. And tensor veli palatini muscle will be supplied by again which nerve only? That's your mandibular nerve, guys. Okay, I think this is the best way to remember about the larynx, pharynx, palate, and the tongue muscles and muscles of mastication, guys. Larynx, pharynx, palate, tongue, and the muscles of mastication. You're going to revise that just before going to the exam, guys. Is it okay? And my students who will be attending the regular classes, they know very well, we'll be doing all these things in detail with the image based, we'll be drawing the images, making it easy and all this. So this is the one thing that you have to revise before going to the exam. Next one. Oh my God. Welcome to the embryology part of the head and neck. Now welcome to your favorite part, sir. The pharyngeal arches, the pharyngeal pouches, and the pharyngeal clefts. Yes, sir. Pharyngeal arches, pharyngeal pouches, and the pharyngeal clefts, guys. Are you ready? Are you ready, my dear friends? Here. I just want a confirmation from all of you people, guys. Normally, like, we started the class somewhere at around 8:15 and now it is like 9:15, guys. It's almost like 1 hour of the class here right now. Okay, now. Almost like 1 hour of the class. Are you people like comfortable discussing further? Do you want me to discuss further, or like shall we stop here right now? You're like, no sir, it is enough here for today. आज के लिए काफी है. क्या हम stop करेंगे? क्या आगे बढ़ेंगे? I just need a confirmation from you people. Then only I'll teach, sir. Why? Because I need my students to understand and learn. Shall we go ahead? Oh my God. Oh my God. Oh my God. Look at that. Look at that. Chalo, sir. So is it useful, guys? Is it useful? It should not be like I'm actually wasting your time here right now, sir. है ना? In the very beginning, someone wrote the message there, sir has wasted over 10 minutes of time. So I think I'm not wasting your time. चलो सर, ठीक है जी. Okay जी, okay जी, okay जी. Welcome here right now, sir. Now let us discuss about the embryology part right now, sir. Yes, very good. Now let us discuss the embryology part here right now, guys. Right now, do one thing here right now. Please write down this in your books right now, sir. आप ना अपनी books में लिखोगे. You are going to write down there. See, first of all, I know that you have seen this diagram like hundreds and thousands of times, sir. You have seen this diagram like hundreds and thousands of times here right now, sir. Okay ना? आपने बहुत बार ये diagram देखा होगा. Now I will teach you here properly right now how to remember this one. Welcome here right now. Pharyngeal apparatus, write down there in your books at least like 2 to 4 questions you are going to get definitely from this on 31st August 2020. 31st August 2020 MCI exam, you are going to get like 2 to 4 questions pakka, definitely from this topic, guys. So I want all of you to be like I want all of you to be like like really alert here right now, sir. I want you to be like really alert here right now, sir. सब लोग यहाँ पर देखिए. Everyone look here right now, guys. Okay. The first thing, there are three words here right now, sir. I think all of you are with me right now. There are three terms here right now: the clefts, pouches, and arches. And I have seen in the regular classes that students don't have a clarity between the clefts, pouches, and arches. Ectoderm, endoderm, and the mesoderm. Now, whatever I wrote here or whatever I have drawn here in the black color, remember that is your ectoderm. Outside here, this will be your ectoderm here right now. And inside this will be your endoderm here right now. And in the middle here right now, my dear friends, remember there will be mesoderm, yes, present here right now. So I'm repeating again here right now. The outer black colored line is your ectoderm. Inner red colored one will be your, the endoderm. And in the middle, the yellow colored one I have highlighted, there is nothing but the mesoderm. सबसे पहले आपको ना ये सीखना होगा. First of all, you have to understand here that ectoderm is the one which is going to form your cleft. So pharyngeal clefts are derived from where, sir? They are derived from ectoderm. That itself is one of the MCQ. And how many clefts do you have, sir? You'll be having like 4 clefts. 1, 2, 3, and 4, guys. And endoderm is the one which is going to form your pouches, and that will be your pharyngeal pouches right now. And pharyngeal pouches here right now will be derived from where, sir? That is your endoderm here. And how many will be there, sir? Again, you'll be having like 4 pharyngeal pouches. 1, 2, 3, and 4. Is it okay? I think, yes. I think you're able to understand. I think you're able to understand this diagram here right now, guys. Yes, that is about the pharyngeal region here right now. This is the pharyngeal. So outer, you'll be having the pharyngeal cleft, and the inner, you'll be having the pharyngeal pouches. Outer, you'll be having pharyngeal cleft. Inner, you'll be having the pharyngeal pouches. 4 clefts and the 4 pouches. So सबसे पहला MCQ, the first MCQ here right now, my dear friends. Remember, the first MCQ that you are going to remember here is that, yes, my dear doctors, the clefts are derived from ectoderm, whereas the pouches are derived from your endoderm. Sir, what about the mesoderm? What about the mesoderm? And that is your favorite one. That will be the pharyngeal arches. Mesoderm is the one which is going to form your pharyngeal arches. Wow, lovely. Mesoderm is the one which is going to form your pharyngeal arches. And what is the numbering here right now, guys? 1, 2, 3, and 4, and 6 here right now. Now you might be thinking, sir has gone mad here right now. Almost time हो चुका है, रात के 9:30 बज रहे हैं और सर को समझ में नहीं आ रहा है कि नंबरिंग कैसे होती है. My dear friend, remember, arches, my dear doctors, will be totally 6 initially, but the 5th arch will degenerate. And the 5th arch which is going to degenerate here right now, it will be remaining here like in, ultimobranchial body. So let me clarify the first controversy here itself. What is that I have drawn here right now? My dear friends, remember, that is your ultimobranchial body. Arey yaar, had hai. In different books, it is given like different answers. Now remember here, once for the last and final time, this ultimobranchial body is what? It is nothing but the remnant of your 5th arch. Ultimobranchial body is a remnant of 5th arch. There is. It's a remnant of 5th arch. Done. So pehla topic khatam, sir. One controversy is cleared here right now, guys. So let us revise again here right now. Is it okay? I think I don't have to go. Yes, I think I don't have to back to that, regular classes wala, that image and all those things. So let us revise very quickly here. Come on. Ectoderm is going to form cleft. Endoderm is going to form pouches. And the mesoderm is the one which is going to form your arches. How many arches will be there initially? 6. 5th arch degenerate. And it is the remnant of that is ultimobranchial body. Done, sir. Lovely. And now we need to learn what are the derivatives right now. Welcome. Ectoderm कहाँ पर होगा सर? बाहर की तरफ. और बाहर की तरफ में क्या होगा यहाँ पर? Ectoderm is the one which is going to form your external acoustic meatus. And which one, sir? The first one. So the first cleft forms the external acoustic meatus. The first cleft is the one which is going to form the external acoustic meatus. And you don't have to worry about the remaining one. All the remaining are actually closed or obliterated. Khalas. That is enough for right now. Understanding, my dear friends, here right now? I think right now, just yes, right now, my dear friends, we are like few days, away from the exam here right now. So I think this is the best way to revise one. External acoustic meatus will be formed from where, sir? The first ectodermal cleft, and the remaining all will be closed there. And what about the endodermal pouches here right now? The first pouch. The first pouch is going to form your middle ear cavity. Along with the middle ear cavity, it is also going to form the eustachian tube, sir, the auditory tube. यार ये तो common sense है. The external acoustic meatus होगा. If there is an external ear here right now, what is going to join with that? The middle ear. So the first cleft is going to form the external acoustic meatus, and whereas the first pouch is going to form the middle ear cavity along with the eustachian tube. Next, after that, the second pouch. The second pouch is going to form your palatine tonsils. And remember that it is not going to form the entire palatine tonsil, only the epithelium of that one, guys. Epithelium of the palatine tonsil. And the third pouch is the one which is going to form thymus. ये क्या करेगा sir? Thymus form करेगा. Remember with the rhyming word, third thymus. Third thymus. Third thymus. And along with the thymus will be going down. And along with that, it is going to form the inferior parathyroid gland. Inferior parathyroid gland, guys. The second pouch is going to form the palatine tonsil, and the third pouch is the one which is going to form thymus along with inferior. Thymus kahan jayega? Niche. So after forming there, it is going to go down. So it is going to form inferior parathyroid gland. Whereas the fourth pouch is the one which is going to form superior parathyroid gland, sir. Lovely. Done, done, done. Are you understanding, sir? So in one diagram, that's why I'm telling you, welcome to our regular classes, guys. You'll learn it like more, nicely. All this topic. In the rapid revision, you're able to learn so many things here right now. So just imagine what will be happening in the regular classes, hai na? So regular classes mein to yaar, all these topics I'll make it like damn easy. You can always take the feedback from my regular regular class student there who have attended my classes there, hai na? Hai na bachcho? So entire anatomy, most of the students will be thinking it is very difficult, phobia, they'll be there. पता नहीं यार पूरा मगअप करना पड़ेगा. No need to ratta, guys. Learn it like this. Is it okay? तो एक ही diagram में we are done with the cleft and we are done with the pouches. Ectodermal cleft and the endodermal pouches. Derivatives done. And now, my dear friends, welcome to your favorite, that is nothing but arches. अच्छा यार थोड़ा सा ना दिमाग लगाओ. Apply some common sense here right now. Pharyngeal arches, they are actually formed from where? Pharyngeal arches will be formed from where? Mesoderm. Yes, mesoderm is the one which is going to form your muscles. Yes, your bones, your ligament, the connective tissue is formed from mesoderm, guys. Okay. Muscles and the the bones, the ligaments, all of them are going to be formed from the mesoderm. Is it okay? Fine here. चलो सर, गोकुल प्रशांत को लग रहा है कि ये YouTube ad हो रहा है यहाँ पर. क्या बात है यार. I'm spending a lot of time here teaching you all these things, and this person is like ad. Oh, क्या बात है. Thank you for understanding, guys. Pharyngeal arches, yes, they'll be derived from where? Mesoderm, and mesoderm is going to form what, sir? The bones and the ligaments and everything. And I'll give you like one of the beautiful diagram here right now. This diagram will save your life in the exam. In this diagram, all the bones and ligaments are covered here right now. All the bones and ligaments are actually covered here right now. So here, my dear friends, everything that you are able to see here in the orange color here right now, this one here right now, will be derived from the first arch. And everything here in the blue color here, it is derived from the second arch. And everything here in the yellow color will be derived from the third arch. So all that arches, pharyngeal arches, it's like layer by layer, everything is forming here right now. Yes, I'll tell you the logic how to remember here right now, sir. Welcome. I'll tell you the logic how to remember here right now, sir. Yes, there are three bones in the ear, guys. Ear ossicles, malleus, incus, and stapes. Malleus, incus, and stapes. ऐसे याद करो. S for stapes, S for second arch. S for stapes, S for second arch. What is left out? The malleus here right now and the incus here right now, guys. Malleus and incus. Yes, very good. Apart from that, there will be a ligament right now here. That is the anterior ligament of malleus. Anterior ligament of the malleus. And number two, second one will be your sphenomandibular ligament. From the sphenoid bone to the mandible bone, sphenomandibular ligament. And apart from that, yes, even the mandible, and that will be further giving rise to maxillary process and all. So even the maxilla will be forming from here. So all this will be derived from which arch, sir? The first arch. Remember, the first arch here right now, sir. I repeat again, the malleus, incus, the anterior ligament, and now, my dear friends, that is a mandible and the maxilla. All of them will be derived from your first arch, sir. All of them will be derived from where, sir? First arch. First arch. Lovely. And after that, my dear friends, welcome here right now. I told you already, S for stapes, S for stapes, S for second arch. Let me take one another color here. Yes, stapes along with the styloid process, follow from there the stylohyoid ligament and only the lesser horn, sir, and upper part of the body of the hyoid bone. Only the lesser horn and only the upper part of the body of the hyoid bone. All this which I have marked in the red color are derived from your second arch, sir. That is all derived from second arch. Another thing that you'll be able to remember from here will be, yes, the second arch you can remember, like, SSS, guys. S for stapes here right now, S for styloid process. Oh my God. S for stapes, S for styloid process, stylohyoid ligament, and the lesser horn of the hyoid bone. So do something, remember for another few days, guys. Another few days you'll have your exam there. So please remember them. And after that, what is left out? We are left out with the greater horn. Yes, the greater horn will be derived from where? The greater horn of the hyoid bone will be derived from the third arch. And इसके बाद तो यार क्या होता है? Every medical student knows that hyoid bone. Hyoid bone के बाद क्या होगा? After the hyoid bone, you will be having your larynx here. Cartilages of larynx, guys. Cartilages of larynx will be derived from where? That will be derived from your fourth and the sixth arch. The cartilages of larynx will be derived from the, yes, the fourth and sixth arch here right now. And I request all my students to revise this topic in the morning of 31st August, guys, and go to the exam. At least minimum, I'm telling you, guarantee there'll be 2 questions coming from here, sir. And in this also, in arches, you always concentrate on the first arch and always concentrate on the second arch, sir. First arch and second arch is important. First arch and second arch is important here right now, guys. Is it okay? So this is all about the bones and ligaments here right now. And after completing the bones and ligament, what about the muscles, guys? Okay, now what about the muscles which are derived from the arches here right now, sir? Which muscles will be derived from the arches? I'll tell you in this diagram only here right now, sir. तो सब लोग यहाँ पर देखिए एक बारी. This will be your arch number 1 here. 1 second here. This will be your arch number 1, then arch number 2, then arch number 3, then 4, and this is your arch number 6 here right now, sir. I'm telling you about the arches and now the muscles. Now, my dear friends, what is the best way to learn about the muscles? Yes, learn first of all the nerve supply. Which nerve is supplied to the first arch? Mandibular nerve will be supplied to the first arch. That is a nerve of the first arch. Which nerve will be supplied to your second arch, sir? Facial nerve will be supplied to the second arch. Which nerve will be supplied to the third arch? Glossopharyngeal. And then superior laryngeal nerve will be supplied to the fourth, and recurrent laryngeal nerve will be supplied to the sixth arch. And these two are the branches of which one only? Vagus. So that itself is one of the MCQ there, guys. Which nerve supplies to the first arch? Fifth one, 5-3, mandibular nerve. Which nerve supplies to the second arch? Facial. Which nerve supplies to the third arch? Glossopharyngeal. And now the fourth and sixth will be supplied by the vagus. If you remember this nerve supply here right now, my dear friends, no one can stop you from remembering the muscles derived. Which muscles will be derived? Yes, whatever, yes, muscles will be supplied by mandibular nerve. Whatever muscles are supplied by mandibular nerve, all of them will be derived from here only. Which muscles are supplied by mandibular nerve? Muscles of mastication. That is the reason I taught you that before itself, guys. Like everything is well planned here right now. That is the reason why I told you about this one. Achha, not only muscles of mastication, 2 tensors, tensor tympani and tensor veli palatini. Tensor tympani and tensor veli palatini. And remember, which has been asked previously in the exam, that is anterior belly of digastric. Anterior belly of digastric here right now. And along with that, remember mylohyoid, guys. Along with anterior belly of digastric, there will be mylohyoid here. Okay, and this has been already, not only this, guys, almost like every point I'm telling you is very much important, has been already asked, and it will be asked again and again in the exam, guys. So कैसे याद रखोगे? Yes, remember the muscles of mastication will derive from first arch. And not only the muscles of mastication here right now, my dear friends, remember the 2 tensors. Remember the 2 tensors there, tensors, tensor tympani, tensor veli palatini. In the exam on 31st August, tensor muscle will be derived from there. कहाँ पर आएगा? Just close your eyes and mark the answer as first arch. Tensor tympani and tensor veli palatini, guys. Done. And then what about the second one here right now? Second arch will be supplied by your facial nerve. And facial nerve is the one which is supplied to which muscle? Muscles of facial expression. All the muscles of facial expression. Along with that, yes, remember the stapedius in the ear, middle ear, stapedius. And along with that, remember posterior belly of digastric. Posterior belly of digastric. And along with the posterior belly of digastric, always there'll be a muscle known as stylohyoid muscle. Sir, इनको याद रखना होगा. That's all. And I'm telling you again and again and again, at least guys, at least I'm telling you, in the morning of 31st August, you are at least going to revise the first arch, the muscles derive, and the second arch, the muscles derive from here, sir. First arch, second arch, तो आपको पढ़ना ही पढ़ना है, sir. You have to learn that, definitely. ठीक है ना? Definitely you have to learn that. And after that, the third, fourth and sixth arch, third, fourth and sixth arch, that is the one which is going to, yes, form which muscles? The muscles of larynx and then pharynx and then palate, guys. The muscles of larynx, pharynx and palate are derived from third, fourth and sixth arch. Take it easy, guys. That's why I'm telling you. I think now you're able to understand here right now. You're able to understand which muscles are at the first arch and second arch are very much important here right now, guys. Is it okay? All of you are comfortable here right now? So not only completing the gross anatomy here right now, sir, the rapid revision of that. Not only that, we've even completed the rapid revision of your, the embryology part, sir. What else you require? है ना? Embryology भी यहाँ पर complete हो गया है. Are you all comfortable here right now, sir? So that's all. So we'll stop here for today, our discussion here right now. And tomorrow I'll continue again at 8 p.m. guys. So join tomorrow. And please, if you people are happy with my discussion here right now, is it helping you? Please inform all your friends to join here right now and take the benefit of these classes, guys. Is it okay? So please take the benefits of your classes here right now. Okay. So thank you all, guys. Thank you all for joining me here right now. So I'll meet you again tomorrow. Tomorrow again we are having at 8 p.m. guys, the same session. So I'll cover the remaining topics in that one tomorrow session, guys. Okay. Hope this was. Thank you all. Thank you all. Thank you all. Love you all. Yes, there is a scope of anatomy. You will surely get the marks from out of that 17 marks. Chalo. So thank you all. Okay, I'll meet you again tomorrow, guys, at the same time. And even don't forget me in your prayers. Keep me in your prayers.